Skills. This webinar is one of our community webinars, and we're fortunate to have Skills for Health here with us today to share about workforce development. So they're going to explore what it means for the wider discipline of workforce planning. And so now I'll pass over to you, John, if that's okay.
Lovely. Thank you, Tara. Good afternoon, or we've just ticked over to the afternoon, so I'm accurate in saying that. We've got some slides that we're going to share with you today as we talk through. I'll just double check with Shannon and with Tara that they're able to present them. Otherwise, I will make sure that I can get them up shortly. But just to reiterate the welcome and the introduction, my name is John Freegard. I'm a principal consultant at Skills for Health. Principal consultant for workforce development, and I specialise in workforce planning. Over the last 12 months plus, I've worked with several NHS organisations to explore their workforce development and to develop their ability and understanding in terms of workforce planning. And I think it's as important now more than ever, probably, given the long-term workforce plan is now with us, that this is a hot topic, and it's something that myself and my colleagues who are joining us today, Andrew and Chris, who I'll allow to introduce themselves when we get to them. It's something that as different specialists with different backgrounds across workforce development and organisational development, leadership development, we've all got an interest and an investment in workforce planning, understanding its methodologies, its application, and how we continue to develop our understanding of putting it into practice. My interest in workforce planning, I'm just going to share this with you briefly, was first sparked not in the role that I'm currently doing now or my previous experience with the rail industry. It started with policing. So one of my first proper jobs, we call it that, was as a emergency call handler, dispatching to emergencies across my home county. And it was there that it really opened my eyes to that curiosity about why was it that we had certain people with certain skills deployed in certain places, what demand and insights were driving that, and how did we recruit, develop and train to that. So I started to ask really annoying questions in that context, but it was in that context that a spark of interest, of curiosity took hold of me. And since then, as I've just articulated, I've worked across different sectors applying workforce planning. So I can see we've got the presentation loaded. If we can just skip on to the next slide, please. Thank you. We've got about an hour, just less than an hour now. And the aims of the session is to provide you with a little bit of history and context as we see it. We're going to talk about a methodology. Now, this won't be a didactic training session. I'm not going to go through the 6 steps step by step, but I will talk about what the methodology is, how it's applied in best practice, and bring to life a couple of case studies, time permitting. I'll cover at least one, but we'll share with you some links that hopefully will give you some useful resource that you can take outside of this webinar. I'm then going to hand to Chris, where we're going to explore a little bit further that relationship that I've alluded to in our sort of practice areas between leadership, culture and workforce planning. We invite questions throughout, so please, I think there's a Q&A function, and I think that's the best place in which to put your questions. If we can answer them today, we will. If we don't get time, we commit to getting back to you, making sure that we address any questions. And we'll leave you with our contact details because this is a relatively informal session. It's a conversation rather than training, and we invite you to join us on that conversation because we're really interested in this community of practice in how workforce planning transacts with program management and how we can further iterate our own understanding and practice in this area. That's a whistle-stop overview, and in the interest of time, let's move on. I'll at this point invite Andrew in just to cover the history and context of what we're talking about here.
Thanks, John. Good afternoon, everybody. My name is Andrew Lovegrove. I'm a senior consultant at Skills for Health. I've been with the organisation now for 14 years, which, seen a lot of changes within the health sector in that time, but it's amazing how certain things remained the same from day one. Little bit about me. I'm a nurse and a health visitor by professional background. I worked for many years in clinical practice before moving out of that into I suppose you'd call it a quasi-learning and development role. Worked for Strategic Health Authority, and then landed at Skills for Health, where I've been, as I say, for the last 14 years. So I feel a lot of the history that I'm going to talk about is as much personal history for me and a little bit of lived experience thrown into that. So in the time-honoured tradition of Chris Whitty, if I could say next slide, please, I will just do a little bit of sort of history and importantly context setting. So, what is workforce planning? And it's very often when you ask people that question, it conjures up all sorts of thoughts and images in their minds. And one of the, I suppose, the most common phrases associated with workforce planning, and some or all of you may have heard this one, is it's getting the right people in the right place at the right time. And whilst I couldn't argue with that statement, there is almost a little bit of a whiff of a cliche and a platitude with it, because whilst it says a lot, it doesn't really help us necessarily with our understanding about what it actually involves. So doing some sort of research and looking around, another definition that I found is that it's a process in which people attempt to estimate the demand for their labour, their workforce, to evaluate the size, the nature, the configuration of what that workforce needs to look like, and then to think about how we source that workforce in terms of how do we supply it in order to meet the demand that we've identified. And I quite like that definition because it suggests that there's a series of interventions or steps that need to be worked through in a way to give you that first definition of getting the right people in the right place at the right time. However, that process can occur in many forms and many contexts. And the key, I think, to understanding workforce planning is almost to think about it in the terms of, so what does workforce planning mean for me? And as someone who spent many years, for example, in clinical practice and had team leader responsibilities, if you'd have come to me at that time and asked me what workforce planning was and what my involvement in workforce planning was, I'd have probably said something to you like, I don't really know. I don't know what you mean, and I don't have anything to do with that. Shouldn't you speak to somebody in HR instead? And yet at the time, I was responsible for organising rotas, ensuring that certain clinics had the right staff in place. So I was involved in workforce planning, but perhaps didn't realise it at the time. So workforce planning can take place in many different forms, different situations, different contexts. But the reality is most of us are all involved in workforce planning in some way or form. We perhaps don't always realise it because we don't tend to badge it in that way. So whatever the context, whatever your role, for me, there are always three core elements involved in workforce planning. And I call these the 3Ds of workforce planning. So the first one of those is to think about workforce planning in the context of design. So thinking about what our future workforce requirements are, thinking about any changes to service delivery, thinking about population demand, thinking about any technological changes, and married that against workforce availability and identifying what a sustainable workforce model needs to look like in order to meet those needs. There's then thinking about workforce planning in the context of development. So how do we need to, and how are we going to develop, grow our workforce, and consider what that involves, and crucially, what that takes. We're perhaps more familiar with the expression, it takes 3 years at least to train a nurse. It takes 5, 6, 7 years plus to train a doctor. But there's more nuance involved in developing the workforce than that. And if we're thinking about changing the workforce in terms of what it does, the skills and capabilities that it needs, then we have to think about how long that lead time is in terms of development. And then delivery, the final D is delivery, actually making it happen. We can all sit and write a piece of narrative. We can all manipulate, well, most of us can manipulate numbers within a Microsoft Excel spreadsheet. But turning something from a piece of paper into real life is a key requirement of good workforce planning, and what leadership and management actions will be needed to realise the aspirations that we're setting out in a piece of paper or in a plan. For me, workforce planning, one of the key principles is that it's cyclical, it's iterative. Anyone who says a plan is complete hasn't really understood, because workforce planning needs ongoing monitoring, evaluation, checking in, seeing how things are unfolding, because there will always be events that we absolutely don't foresee that may affect the deliverability of the plan as we originally set it out when we first developed it. So those are some key concepts for me about what workforce planning is. I could talk more about that, but I know time is not on my side. So moving on, where has workforce planning come from? And speaking, as a nurse, I think there's not a particular date we can sort of pinpoint in the diary. For example, to take my rota example, we've been doing things like that since the days of Florence Nightingale. So thinking about what workforce requirements we need is not new. However, for me, 2007 was a big moment in the history of workforce planning, because that was the year that the UK Health Select Committee produced a report that basically said the way the NHS plans for its workforce wasn't great, and there were too few people with the capabilities to actually undertake and drive forward workforce planning. It was done well in certain areas, but that was episodic in nature. And whilst there were good pockets of workforce planning, it wasn't consistent, and the approach to it wasn't sustainable. And over the last, 13 plus years, we've had various events that have happened where perhaps workforce planning has fallen off the radar to some degree, but in very recent history, it's had a new light shone on it. And in general, I think workforce planning, where has it come from? It tends to become an issue when we have episodes of labour shortage, and we can't rely on the old taps to flow out the workforce that we require. And I think, as we face huge shortages in key areas in the NHS and the health sector, it doesn't surprise me that workforce planning, if we think about it as an ebb and flow, it's definitely in a flow state at the moment. So next slide, please. So why is it needed? And almost some of what I've said has already begun to answer that. But if we don't plan for our workforce, then the opposite of my opening definition in effect becomes a reality. The treadmill of service demand and population demand, is a treadmill that just never stops. It keeps going, and in fact, it just gets faster. And therefore, the need to ensure our workforce is enabled and equipped to meet the needs of those who use our services is absolutely vital. We've got the workforce challenges in terms of supply that we need to think about. So if we don't think about workforce planning, we run the risk, and in many places we are seeing those risks turned into real life issues where we're unable to sustain the levels of workforce we need to provide those safe, sustainable services. But being sort of glass half full for a moment, I think, why is it needed? Well, it also gives us an opportunity to reflect. So, for example, if we're working in an area that has high turnover, high levels of attrition, sickness, why is that? Can a workforce plan help us to identify some of the root cause issues? And can the delivery of a workforce plan help to address and change those in order to put a workforce on a more sustainable footing? So why now? Why now in October 2023 do we need to think about workforce planning, and why is it needed? Well, as I've already said, the demographic time bomb is ticking. We have huge shortages of NHS staff. And whilst, yes, we have a national long-term workforce plan, there's a whole tranche of work that needs to happen underneath that national plan. And whilst I'm encouraged to see that plan published, that in of itself won't deliver the transformation teams, organisations, and importantly systems need to think about in terms of realising the ambitions of the plan, and indeed other drivers to create a sustainable future workforce. I think the challenge of workforce planning is it's a bit like planting oak trees. The fruits of our labours may not happen in a day where we get to experience the benefit, but the risk of not planting those trees will only store up trouble for us in the future. So I think at that point, I'll hand back to you, John.
Wonderful. Thank you, Andrew. Really appreciate your insights there, and really enjoy listening to your experiences bringing this topic to life. And just one of the reflections in terms of the why now and the long-term workforce plan, I completely agree with you. Welcome the plan. It's better to have one than to have the absence of one. But the three pillars or priorities within that plan, train, retain and reform, like you said, they are proverbial oak trees. And I think that's why the encouragement for anyone practicing or interested in workforce planning is to yes, focus on the long term, but also introduce a method and a way in which you can plan that might maybe focus on one of those three pillars. And from my perspective, I think the most tangible and grippable, if that's a word, from many people's perspectives working within systems and trust will be the retain followed by reform. But that's just a reflection from me. Thank you, Andrew. I'm going to talk a little bit now about our methodology. Some of you may have heard of this, some may have used this. Other methodologies exist. This is Skills for Health's 6 steps methodology to integrated workforce planning. Hereafter, let's refer to it as the 6 steps. It was developed some years ago, so we're probably going back to that juncture that you were describing, Andrew, maybe just before then, around 2005, 2006. I think this was first iterated. It has been developed working almost exclusively with NHS organisations and private healthcare organisations. So it's been developed by Skills for Health, but working specifically with healthcare. And it's concerned with, exactly as you described, those 3Ds: effective design, development and delivery of the workforce. We truly believe that's the most important aspects that underpin integrated care systems as is now, to sustain themselves in short, medium and long term. This methodology identifies those elements that are going to be needed in any workforce plan. What it doesn't do is specify that scope. So it allows you or anyone applying this method to consider what's the most important thing right now, and over what time frame, what part of the service are you going to focus in on. It enables people to consider the current and future demand for services, and I'll talk through the steps in a moment in brief. The local demographic situation, the impact on other services is particularly important when we're looking at system level, and also organisations that are within the system do not operate in isolation. It is the only such methodology that was cited as a tool in the NHS long-term workforce plan to help with workforce planning. It is referenced within the long-term workforce plan. There is, I think, helpfully in the chat, there should be a link. It will take you to our website. There is a free checklist, a downloadable list, where you can access what's in front of you on this slide, but in a little bit more detail in your own time. Very briefly, just looking at the steps. Step 1 is a crucial first step, and one which, if you are to follow this methodology, I'd encourage you to dwell on and return to many times. And that's about identifying the purpose and the scope of the plan. Who is this for? What's it going to achieve? Who's going to own it? And who's going to take responsibility for sustaining it? Dwell on step 1. Understand why you're doing this, why workforce planning is needed, and then move to the service change. Identify the benefits of the change. What's your theory of change here? What's going to drive this? What's going to be a barrier? And then look at potential working models. Steps 3 and 4 in particular are interchangeable, although I would say that whilst it's laid out in the infographic in front of you, sort of roadmap fashion, think of it more circular. That actually is necessary to return to previous steps. But step 3 is about defining the required workforce for the service that you need. Step 3 is purposefully before step 4, which is understanding your current workforce availability, so as to not limit your scope of thinking, your ambition around what is actually required to deliver the service, as opposed to be limited by what you currently have. That will give you the gap. By doing it in that way, that will give you a true gap of what your service requirements need to be and what you currently have in which to deliver them. From there, step 5 is all about developing the action plan. This goes back to Andrew's point around the right staff, right skills. It's the 3Ds. Step 6 is tempting to use that as the full stop. I'd encourage that more as a point of punctuation, but it's certainly not the end. That's about implementing, monitoring and revision, and that's where you may need to, and more likely will need to, circle back round to the beginning. The 6 steps is a methodology that we could spend far longer than an hour on, but I'd encourage you to go and have a look at the checklist, which you can download, and obviously welcome any feedback or questions on the application of the method in good time. But if we move on to the next slide, please. The method itself doesn't do the work. It gives a framework, but it doesn't do the work. It's not painting by numbers. Workforce planning is, in its nature, complex, and can be very challenging, particularly if you're looking at longer term and big scope. And so to make it effective, along with the 3Ds that Andrew was describing earlier, at Skills for Health, we also believe that there's there's another trio of things that need to be present in order for workforce planning to really stick and sustain itself. That is to have a method. Now, obviously, we are talking about the 6 steps because it is our method. We believe in it, we apply it, and we see the benefits of it. Pick a method, use a methodology. Like I said, other methodologies are there. Use one that works for you, but pick one. Then apply other tools. So the method itself isn't all of the thing. You need to understand workforce diagnostics, readiness assessments, and approach to quality assurance, all of which are almost sub-disciplines of workforce planning. You'll need to bring in the right people. And that's where you see at the bottom there, decision maker. I will talk about that a little bit more in the next slide, but that's decision makers. This is a collaborative effort we're talking about here. And we need to introduce strategic thinking. So are we able to lead through change in a collaborative way? Are we talking about systems leadership? Are we able to do that yet? And workforce consultancy. Now, we talk about consultancy as an external partner working and serving the NHS. But even internally, if you are driving a program of change or a project of change, then there is an element of consultancy and coordinating and encouraging, sort of fostering that collaboration that's going to be necessary. The 6 steps can underpin all of that, and it can support with all of that, but it doesn't do the whole thing. And hopefully that's what that infographic there is making clear. In terms of making it effective, we need to bring together all of these components of workforce planning. Just move on to the next slide, please. I won't dwell too long on this one. This is just some feedback from some of the more recent workforce planning exercises that we've worked with these different organisations that you can see on your screen. I'll just draw your eye to the Birmingham Community Health Trust. This was feedback from one of the HR business partners that following a programme of work where they were looking to apply the 6 steps trust-wide, one of their reflections was that they really needed to know their business. So as a HR business partner, this person would have been very well involved in their sort of allocated division or area of the trust anyway. But what this method highlighted for them is that necessity to integrate their thinking, to integrate their interest across within their division and to others. And you can see there from their quote that they really know their own business. Even if they didn't want to know something, to make it effective, they needed to be involved. And so that's one quote that I wanted to draw your attention to reiterate the importance of bringing together those components of workforce planning. Next slide, please. I think it's important as well to reiterate this idea of decision makers and the importance of integration underlined. You can see here that in any program of work, again, we're working to the rule of 3s. Any program of work, when you're looking at a workforce plan, for too long, I think in my own experience and my own practice across different sectors, workforce planning still to a large degree is seen as the domain of HR. Now, we all know that HR is it's a broad church, isn't it? You know, the continuum of different skill sets within HR, from generalist to specialist, is a large range, and workforce planning, quite rightly, does sit within the continuum of a HR skill set. But again, it's not all of the thing. Workforce planning cannot be done by even the best HR practitioner in isolation from the rest of the organization. And in any program of work, and depending on the scope of your workforce plan, I would encourage you to consider it as a program of work, if not a project, depending on the as I say, the scope and the size. And we know in any program there are different roles to be played, and different people play those roles, and HR are a significant part of it. and you will need to bring in their skill set, whether that's through a HR business partner, a HR manager, or a more specialist workforce planning manager or strategic workforce planning manager. There'll be different flavors depending on your organization, and they definitely play a role. Whether it's the lead role or not, I think is down to understanding the decision making and responsibilities. It goes back to step 1 of the 6 steps. What we're trying to illustrate here in any program of work when it comes to workforce planning, the best practice and the case studies that we've seen where this sticks and is sustained is where there is significant interest from operational leaders. Now that could be clinically led, could be non-clinically led, but there are operational decision makers who take an active interest and ownership of the plan. Their interest and level of influence is significant. Now, I wouldn't want to say sort of predetermined that they must be the SRO or anything like that. Again, that goes back to step 1 in defining the ownership and responsibilities. But that's a feature, and that's what we've seen over the years, that in the absence of an interested and influential operational leader, it has an adverse effect on the effectiveness of a workforce plan in the long term. Bringing in HR, as I won't repeat myself, but it's worth reiterating at least, they must be involved. You know, there is a unique skill set and perspective that they bring. I think one of the most overlooked, and it is overlooked at your peril, are colleagues in finance, in the finance community. They are often, and perhaps unfairly, perhaps sometimes fairly, perceived as a barrier to service change. Now, that doesn't have to be the case. What I've seen where it hasn't worked is they haven't been involved in the program of work. And therefore, when a change is required and a business case is put forward, perhaps on the back of a workforce plan, which is recommending a change to the service, and perhaps that service needs to increase its whole-time equivalent or other costs, whether that's capital increase or staff increases, inevitably in many of our organizations that requires a financial sign-off. Now, if that's arriving at the desk of a financial decision makers after the fact, as it were, that's going to be a problem. It sounds obvious when I sit here and say it out loud. What's less obvious in many workforce planning programs that we've seen is to bring in finance. In many organizations now, we have financial business partners who operate much like HR business partners, but with their own particular lens and interest. They need to be part of this and part of the conversation early. If we're talking about barriers and drivers to change, to service delivery change, financial constraint is going to, or financial creativity is going to present itself either as a driver or a barrier. So bring in your finance people as early as possible. Consider them part of the program, part of the project, and get them on board sooner rather than later. We move on to the next slide, please. Thank you. I've got a couple of, well, several case studies that we could talk through. In the interest of time, I'll perhaps dwell on the first one, and then I can refer you to our other case studies on our website. We've got many workforce development case studies free to access that you can read through and see how other NHS organisations have gotten on in the application of the 6 steps. The third case study there isn't one that we can claim to have worked on, and it's one that has always interested me because of my initial background in policing, and it's Durham Constabulary. I'll talk a little bit more about them shortly, but firstly, if I can just draw your attention to case study 1, STW. That is Shropshire, Telford and Wrekin ICS. Now, we've completed a program of work with them recently. Health managers across the NHS providers at that ICS in Shropshire, Telford and Wrekin, they partnered with us and they wanted to learn more about integrated workforce planning. They wanted to do that at system level. Now, some of their challenges you will recognise. So in terms of the workforce, they wanted to ensure that the right skills were available. They wanted to achieve consistent health benefits for the local population. In terms of transformation, they wanted to achieve greater service integration whilst meeting the financial requirements. And they also recognised that there were changing population health needs. So meeting health and care needs in the context of rising demand and also the rising complexity across the system. So increased acuity, for example. For our part, we applied the method, and that method is shared with the system and a number of managers from different positions from across HR, from across finance, clinical, non-clinical, as I was describing, that sort of integrated approach, to provide them with a tool and the knowledge to understand and then apply what we consider to be a robust approach to workforce planning. We talked about defining the plan, mapping a service change, defining their required workforce, understanding their current workforce availability and defining that before developing their action plans. So we had representatives from across the different NHS trusts take part in the programme. It's concluded, but as Andrew was saying, and as I was hopefully making clear in the 6 steps overview, it's just really started, and the fruits of the labour will be seen across the next year plus. And for our part, we're interested in going back and seeing how it's been sustained. But whilst they started with a system-wide approach, they have been working on more discrete parts. So as you start with a system, but naturally you come down into trusts, there are, let's call them, silos have a bad reputation, but they naturally fall into their own sort of constituent parts of the system. So they have been working across important system projects that include diabetes transformation, a hospital transformation programme, an MSK transformation programme. What's been encouraging to see, though, is where there are programmes of work where care pathways cross over the 2 trusts or multiple trusts. Some of the participants focused on service-specific plans within individual organisations, so looking at things like pharmacy, blood science, AHPs specifically. And what it's done is enable all of those groups coming together at system level initially, focusing in on their areas of priority, is to share what they're doing. So it's making workforce planning increasingly integrated, a shared methodology working across different trusts within one system, and then sharing that learning back to say, this is our area of priority, this is why we've picked it, this is our current scope, this is what we hope it will achieve, and being open and transparent with colleagues from across the system. It's a real success, and as I've said, and I think it's popped in the chat, you can read the case study in full, and for our part, we'll be interested in returning to that particular system to find out a little bit more about the impact that it's been having across the next 12 months plus. I won't cover Birmingham. I mentioned them in brief earlier because I am conscious of time and want to give Chris enough time to talk through the next part. But very briefly, Durham Constabulary. For those unaware of policing, they are regularly inspected as to their effectiveness. Part of that effectiveness inspection regime looks at strategic planning, and as part of that, workforce planning. Historically, when HMIC, which is the inspectorate, it's now HMIC FRS, when they initially came into the 43 forces in England and Wales, across the board, the development and application of workforce planning was much as what Andrew described earlier, in terms of it was very comparable to NHS circa 2007, good in patches but inconsistent. Now Durham took a very interesting approach to this, and they leaned on what most police forces are good at, and that's governance. And in a very innovative way introduced very clear governance and ownership around workforce planning. Now, they didn't use the 6 steps, but they used a methodology, and they were consistent with that methodology, but they focused on what we would describe as step 1, and that's the scope, the ownership, and they put in clear governance, responsibilities and accountabilities, and they integrated that, so it didn't sit within a corner of HR. They were able to sustain outstanding ratings for several years, and they continued to do so. And it was very simple in terms of that governance and ownership piece. I say simple. It looks simple, but obviously, if it were, everyone else would be doing it. I think the main thing for me, when I've looked at Durham from afar and tried to appreciate what they were doing, it was the consistency. And they had nailed their step 1 effectively, and they had stuck to a methodology, and it gave the community of Durham a better service as a result, and continues to do so. So that's one where I'll see if I can find the link and share that with Shannon, but it will be on the HMICFRS website. At that point, I'll stop there and ask for the next slide and introduce or allow Chris to introduce himself, please.
Afternoon. Thank you, John. Thank you, Andrew. Lovely to, I can't see anybody, but I gather you're in the background. I'm pleased that you're here and we can spend some time talking about this. So my name is Chris Burling. I'm the Principal Consultant for Leadership and Organizational Consultancy at Skills for Health, and have been here for a few years now. I've come from the public sector. My background is in public sector leadership teams for a number of years in both higher education at the University of Bath, working in actually high performance sport, the high performance sports system as a starting point, and then into the wider university, delivering training and development, and moving progressively into organizational learning, organizational development, which is when I took my chance to move into executive education, followed that the NHS Leadership Academy. And as I said, I've been working at Skills for Health for a few years now, heading up the practice of leadership management and organizational development. So really pleased to be invited here, and always delighted to have the chance to share the stage with colleagues John and Andrew, and always feel a bit of a fraud, actually, because I guess what I'm going to attempt to share, talk about, Andrew and John describe eloquently and persuasively, and in many ways capture the key ideas behind this question of complexity of systems, of addressing what are broadly systemic issues, and the integration of leadership culture to workforce planning. It is clear, if you're listening carefully, the language that both John and Andrew use, the way they reflect on the 6 steps, and the way they seek throughout all the steps in that process to think about the broader system, and to work with colleagues in different areas, and to integrate ideas, and to use it as a map, a guide, to develop an understanding, and then to work within that understanding. They're all critical components of where we're starting from. But I think as Andrew said very early on, as he was introducing the model, there is a real difference between knowing and doing. And I think there are things that we know, and there are things that we do, and the extent to which they are always consistent is perhaps not as much as we would like. And that goes to everybody. I guess my domain is working with leaders, organizational leaders, system leaders. And to do that, we seek to work with them at multiple levels and try to understand the decision-making process, how they think about things, how what they think about enables them to think about the issues they're facing. And it's why I guess we consistently strive as an organization, as an organization rooted in research consultancy, to try and progress and to iterate and evolve, and where we can to attempt to support our colleagues working in health and care to be as well placed as possible to respond to what are grand, major, deeply rooted, often intractable issues that we see in the NHS and across its workforce currently. So a little bit of context, and then I'll whiz through this. But John and I first started talking about this a few months ago, probably in the summer, and it was a point by which we were starting to think about, well, how do we, as an organisation, we believe in multiple perspectives. We have a number of experts, we have a number of disciplines within our organisation. As much as possible, we try to come together to think about how the coming together of those practice areas, those disciplines, can support and elevate the work we do more generally within organisations and systems. And we talked for a number of months around what does it mean to think about workforce planning, but to think about it through the lens of leadership and culture, to think about it systemically. And the question we landed on, as I'm talking, I'm still feeling like I should apologise for. So this is hopefully the way I talk about this reflects the stage where we are in our thinking. This is something that we're just starting to throw around and try and understand to move it forward. We ended up with this question: are leaders suitably prepared for the complex systemic issues that we see in our contemporary environment? And that's not just situated in work, but it's in and out of work. And are they able to determine how the demands will be met through workforce planning and the assumptions we make around the process we follow in terms of workforce planning? And that was our starting point. I'm really lucky, I'm really privileged in many of the areas I work. I get to work at the edges of ideas. What's emerging in contemporary thinking? What's making moves? What's changing the landscape of how we think about addressing these issues? But of course, everything we do is the idea is that we translate this into practice. We apply it in context. So if I can ask for the next slide, please. Thank you. The context we're framing this in, of course, one of the contexts is this idea of the workforce plan, long-term workforce plan, which is in theory a really good idea. And I think colleagues more experienced than me will have reviewed this and looked at this and identified many positive elements to having a long-term workforce plan. There are some assumptions, and people perhaps that are taking a more critical lens on this start to pick apart. Well, actually, there are some issues within the idea of a long-term plan. The previous slide talked about how did we introduce complexity. How do we work with organizational leaders, workforce planners to understand complexity? There is still a tendency to want to reduce things down to their most simple parts. And that's for a number of reasons, but it's a tendency that we see relatively frequently. And therefore, the idea that potentially by adding more resource, that will negate some of the issues we face within the workforce and society. As a standalone idea is probably flawed. Now, I know this workforce plan talks about interdependencies, and I know in the field of retention, which I think is important to the talk today, I know the reference to culture is really important, and that's really helpful for us as practitioners. It gives us a chance to understand this in the backdrop of major societal change. It gives us a chance to look at this within the idea that things are changing, things are going to change, and at the very least, we are all just part of a steep learning curve as to how we work within that frame of reference. The answers, the solutions are not going to be easily predictable, and they're going to require us to think about things in a particular type of way. But this is, I guess, a sense of hopefully gives a sense of security that what we're doing is framing it in the context of something that's very relevant to where we are now. If you move on to the next slide, please. So this is the next stage, I guess. So I talked about the time myself and John were talking about this. What question did we land on? We landed on, are leaders prepared? Can we look at the culture of an organisation and say, are you best placed in order to deliver a workforce plan? And this is the next step for us, really. When we started to frame the question, what was important? We looked at the intersection of leadership and management. We looked at the intersection of organisations, the challenges of attempting to apply a more deliberate strategy to something that's very complex. And we started to say, well, what do we need to do? And the first stage was to address that question of why. So what are we seeing? And firstly, we're seeing a critical lens on the implications of that long-term workforce plan. In many areas, we're looking at the finances and the ideologies of it, and we're starting to see actually how can we be critical of this? How do we start to think about this in a way that enables us to perhaps challenge and contest some of those assumptions in a way that's helpful to supporting systems and system development? We obviously are rooted in the future of health and care. Much of what I do, much of what our workforce does in the organisation, start to think about the future. I know it's people on the call will be doing the same thing. Even if you don't work in health and care, the future of it is important to us. We know, and evidence tells us, that the health of our population is linked closely to the circumstances of our daily lives. So the way we live our lives, the way we think about how we work as a society, as a system, is important, and being able to address that is equally important when you look at this integration of leadership to workforce planning context. And then we start to think about this idea of workforce planning and strategy, and of course there's a tension there, because to take a workforce plan requires you in many ways to have some type of approach to strategy, and yet having some sort of approach to strategy generally requires you to feel confident in something, to predict something. Your ability to be confident and predict something is deeply reflective of who you're working with, how you're working, what do you understand by your environment, how do you understand the future, what requirements do you have, how can you consider many of the interdependencies. So to have that strategy and to plan, there's a real tension there. The risk, of course, is that we just don't know. And therefore we start to think about things, we start to assume things, and we make assumptions about things. Of course, the challenge that those assumptions are wrong is a real risk. So then what is it then? So how can we do this? What change can we make? And I think we're starting to consider, how do we make the shift from a trust to a system perspective in workforce demand? How do we start to think about moving into that systemic view of a workforce? That requires certain changes in how you think about things. How do we develop a model of what we're calling collective impact? And collective impact is a term not frequently used within health and care. It's more broadly used within different sectors. But what it's talking about is a perspective by which multi-agency actors are coming together, working together to establish a shared purpose to how they address issues, generally societal issues. So we start to think then again, workforce planning is a part of social change, instead of something situated in HR. I think its reference was earlier, situated in places in an organization that have limited wider perspectives on social change. So how have we started to do that? What we've started to do is think about how we can apply system thinking as a frame for development. How do we supplement the planning process, of which 6 Steps is a really wonderful guide? How do we supplement that with a greater focus on relational practices and a more emergent strategy? That will take a greater emphasis on exploration and discovery. And what we're starting to talk about is the concept of an impact gap analysis. Now, I was really pleased in the section, and as a provider of the NHS culture and leadership program, and we've delivered that in a number of trusts over the past 12 months, as something that's a helpful indicator of how you can go about doing this. So we have brought in some current case studies of the cultural leadership program as part of how we think about this process. And that was our steps towards the process. Next slide, please. So it brought us to, and we can move to the next slide straight away actually, brought us to a question of, so can we? What can we do? So we asked, are we able to? And then we'll move into, can we address this? And the next slide, my final slide actually, articulates where we currently are and where we invite, I think, colleagues across the systems, across the NHS to start to work with us as we think about this integration between culture and leadership. We're starting to elevate this terminology of mapping the system. Now, like I said, this is not our terminology. We're working closely with colleagues in different sectors. But actually, as we see a really important change in the way that colleagues are starting to think about workforce planning, and myself and John have been at a number of conferences and events over the past 2 or 3 months talking about this, the language that people are using, the approaches they're taking are starting to move towards a more complex perspective. So we're elevating workforce planning, attempting to elevate this through this idea of mapping the system. What we call apprenticing with a problem, again, is working with colleagues from the social entrepreneurship sector in the main, is starting to apply a lived experience and experiential education lens to the way in which we consider workforce planning. In taking a lived experience and experiential educational lens, we're able to focus on these 3 pillars. We're able to look at a system impact, a social impact, and a collective impact. Through looking at each of those 3 pillars, what we're starting to see and what we're starting to explore, and we'll follow this, I'm sure, with more details and share resources and some ideas that John and I in particular are starting to unpack around this, is what can we offer? How can we add to resources, to tools, to guidance, to knowledge? How can we elevate all of those access to materials in a way that enables workforce planning, people working in this field and more broadly, because I think, as we've said, it's important to work more broadly. How do we do all of that in a way that enables us to work at a system level, to address social change, and to do it through a collection of actors across the whole system? And a key part of this is inviting the system into the room, letting the system see itself, and through letting the system see itself, start to look at a sustainable, longer term approach that is rooted in complexity and not predictability going forwards. John, I'm going to wrap up there and hand back to you.
Many thanks, Chris. Really compelling, interesting stuff. We have, like, as you say, started the conversation. We invite people to join us as we continue it. Conscious of time, we're almost at the hour. So before I hand back to Tara to wrap up, I'd just like to say thank you to those that have joined us today and to those that will listen, hopefully, to the recording. I just invite you to get in touch. You've got our contact details there on the screen. You can reach out to us individually or through the Skills for Health website. If you do find what we're saying interesting and potentially helpful, do go to our website. Various links have been shared. You can sign up to our newsletter, that sort of thing. We do like to share our thoughts on the subjects that we care about. And if you particularly enjoyed listening to Andrew, I must say that he's got a fantastic podcast. It's Love Growth on Health. You can also find that through our website. Thank you for your time this afternoon, and I'll hand back to yourself, Tara.
Thank you. That was excellent. Thank you all for sharing that with us. And like we said, if anyone has any questions they want to ask now, you can pop those in the chat, or you could add them to the Q&A. And if there is something you want to follow up with, you've got the contact details just there. We are hoping that these gentlemen are going to come along to our conference and share more about this. And this workforce planning is one of the topics that will be on the agenda for our conference, which I'm going to put a link in the chat, hopefully, Shannon, to express your register your interest for attending that, which is the 9th and 10th of October, and it's going to be in Birmingham this year. So this is where we would really give a round of applause to all of the speakers today. So join me in giving them a virtual round of applause if you can, just to show your appreciation. Thank you all very much, and I think that's it for today.
Thank you all.
Thank you. Bye-bye.